It's worth reflecting, actually, that the Global Fund to fight AIDS, TB, and malaria was created in response to the last big pandemic to hit humanity, HIV/AIDS, which, as of now, has killed about 32 million people. And the driving rationale behind the creation of the Global Fund was about access to antiretrovirals. And I think one of the things we need to learn from that is actually we were too slow that time round. Millions of people died because we didn't get antiretrovirals to places like Africa fast enough. And we need to learn that from that. And in the way that Seth has been talking about with vaccines, but also with diagnostics and therapeutics, is the issues of scaling up global access, equitable access, are massively important because so many lives are at stake. We are acutely conscious of the interaction between the challenges of COVID-19 and the ongoing challenges of the three biggest infectious diseases in the world, measured in terms of how many people they kill: HIV, TB, and malaria. And it's worth putting in context, and this is without diminishing the threat of COVID-19 at all. COVID-19, I think, has killed about 290,000 people as of yesterday. The running total for the year for HIV, TB, and malaria would be about 1.2, 1.3 million. And sadly, the biggest share of that are people living in Africa. We have been enormously impressed, actually, and I think the leadership that Amira has shown and the AU has shown has been fantastic. The way Africa has responded to the challenge of COVID-19, fast, decisive, coordinated response, has been enormously impressive. And testimony to that is the fact that to this date, only, I think it's, you said, Amira, 2,300 people have died. It will get worse. And the issue, I think, the big challenge for Africa is that some of the things that have been done are going to be really, really difficult to sustain. Lockdowns are difficult to sustain in rich countries, but where households live on the income they earn each day, they're very difficult to sustain. Where people live in very close proximity to each other, social distancing is very difficult to achieve. Clinical care, ICU capacity in many African countries is extremely limited. So actually, Africa is going to have to leapfrog to the most sophisticated strategies around massive testing, tracking, tracing, if it's to control COVID-19, not just to save people dying of COVID-19, but to save people dying of the knock-on impact on other diseases. Because I think it is far from implausible that the true cost of COVID-19 in Africa is going to be measured more by its impact on other diseases, either by children who haven't been immunized or from the incremental deaths due to HIV because people haven't been able to get their treatment and maintain virally suppressed, or incremental deaths due to TB. We've seen some dramatic reductions in TB case notification in Africa and elsewhere in the world, and or disruption to services, treatment services for malaria. One of the great achievements of the last several years has been reducing child mortality due to malaria. The trick to that is when a child gets a fever, you want them diagnosed and treated within 24, 48 hours. If disruptions to health services, if you've clinical health workers being sick or unable to get to villages, if parents are scared to take their kids into clinics, we will see that death toll go up, and we will see it go up very, very sharply. It's a sobering reminder that the Ebola outbreak in West Africa in 2014-15 killed more people due to incremental deaths due to malaria than it did to Ebola. So from a Global Fund perspective, we sometimes get asked as to whether or not we are diverting our attention from our core mandate of HIV, TB, and malaria to fight COVID. And we say no. To fight HIV, TB, and malaria, we have to fight COVID. Because if COVID overwhelms the health systems, if it makes health workers sick or incapacitated, it will have this massive impact on HIV, TB, and malaria. So what the Global Fund has done is we introduced, a bit like the way Gabby did, we introduced flexibilities in our grants to enable countries to use funds they already had deployed to them at the beginning of March. So far, 75 countries and 5 regional grants have used that flexibility. It's a flexibility with a total envelope of about $500 million. But we quickly realized that that wasn't going to be enough. So we have also introduced a second mechanism, and that mechanism releases another $500 million. So in total, we've made available about $1 billion to do 3 things. One is to help countries adapt their HIV, TB, and malaria programs to the COVID environment. So it's some of it's really simple stuff. It's dispensing 6 months of antiretrovirals instead of 3 months of antiretrovirals. It's distributing bed nets to individual house doors rather than bringing them to the central village and getting everybody in the village to come and collect them. But a lot of these things actually do have incremental costs. Secondly, it's to help countries with their immediate COVID-19 responses. And we are providing personal protective equipment, PPE, we're providing diagnostics, and we're supporting the whole range of emergency response activities of different countries. And thirdly, it's about fixing urgent gaps or deficiencies in health systems, whether it's a lab capacity and so on. And so we hope from that to be able not just to help countries respond effectively to COVID-19, but also to be able to protect their ability to continue to sustain the programs they're running against HIV, TB, and malaria. As I say, I actually think that Africa has responded remarkably and impressively quickly. I think the challenge, though, is that we're at the very early stages of this battle, and the scale of the resources and the degree of sort of community support and engagement to sustain it is going to be enormous. So we have a big fight ahead of us, and it's going to require both leadership within the country, within the countries, within the continent. It's going to require leadership at a community level, but it's also going to require a lot of support from outside.